What's up, nerds? Welcome to Pirate Radio, the Enterprise IT podcast. Today's guest is SCL Health Chief Information Security Officer, Howard Haile. Howard joins us to discuss healthcare security in the age of ransomware. Howard is a CISSP, healthcare security thought leader, and an all-around IT pirate. Howard Haile, hello and welcome to One Technology's Pirate Radio.
Hey, Matt, great to be here. It's good to talk to you again.
Absolutely. I think it's important that our audience understands our relationship before we get started. So if I should tragically pass, explain to the listeners what your responsibility would be contractually. But specifically in terms of attendance at my funeral.
Oh yeah. Well, if I'll have to attend your funeral, and I have to bring like a D-list celebrity that pretends that they knew you, just to make the entire audience wonder how Matt Brown, knew, Jose Canseco or something like that.
I worry that Charles Barkley would be confusing, be a hard one to sell. But I think you could convince people I knew Mario Lopez.
It's true. Yeah, probably could do that one. I know you've got a list of a few that I can choose from. So we'll definitely make that happen.
It got shorter with the parting of Burt Reynolds, but we'll figure it out, Howard. So
yeah, exactly.
Well, on that, to quote Blanche Dorothy Rose and Sophia, thank you for being a friend. Thank you for doing the inaugural Pirate Radio podcast.
Hey, it's an honor. It really is. I'm excited about this. I think it's going to be a lot of fun.
Perfect. Well, with that, we'll get kicked off here. So first question is, how would you describe the state of healthcare security in the age of ransomware?
Well, I think if you have been paying attention to the news and you see the amount of successful attacks against healthcare, whether it's small or large, you'd think that it's pretty poor overall. I think overall that it's gotten a lot better, but I still definitely feel like it's below where it needs to be to meet today's threats. But you have to remember also the healthcare is still pretty early in its digital transformation. They only started digitizing medical records with the Affordable Care Act. And, since then, there's been just a massive amount of transformation that's been going on in healthcare. And a lot of times that transformation gets out in front of security. So overall, I think it's advancing, but still behind where it needs to be to meet today's threats.
It with things that have been in the news lately, it feels like regardless of the vertical, people are behind. It's a difficult problem that it's not unique to healthcare by any means.
It isn't unique to healthcare for sure, but healthcare is a little bit unique in the fact that operations can it isn't just disrupting the flow of money or profitability of a hospital health. It can actually have life and death consequences for patients, and there have been adverse events that have happened with patients due to ransomware attacks, and so when you talk about a successful ransomware attack against healthcare, you very well could be talking about the loss of life. And so I think the stakes are higher in healthcare as a vertical, but you're right. It's just epidemic across all industries.
Yep. Second question, according to Health IT Security, results revealed that the healthcare sector appears to be less equipped to stop ransomware attacks than other sectors. Attacks succeeded at encrypting healthcare data 65% of the time compared to the global average of 54%, both of which are high.
Yeah.
How can the enterprise security and technology community better support the healthcare industry to improve these numbers and reduce the life-threatening impact of ransomware in the healthcare space?
Yeah. So I think there's probably a few things that can be done, when you're talking about just the enterprise security and technology community in general. Really, I think a big part of it is lessons learned and best practices across industries is something that definitely needs to, be shared and have a better way in which there could be a retrieval of, say for healthcare, we don't necessarily have big touches into like the financial sector who have been doing security, because they've been under attack for stealing people's money for, forever. And so, are there ways that we can learn from what the financial industry is doing, for example? But there's not a good way to share that type of information. So being able to rely on partners who cross industries and share best practices, I think that's one area that can definitely benefit healthcare. I think another one is, if you think of healthcare in technology sense, it's a very complex web of both technologies and systems that are designed for provider efficiency first. And not necessarily security is at the front of their mind when they're designing systems and such. And so I think when it comes to those type of systems, understanding technologies and partnerships with with the communities and different technology partners that can improve security in healthcare without disrupting our provider workflows is definitely needed. And so a lot of times healthcare has some very old systems, and we've built a lot of different workflow processes around those systems, and so you really can't disrupt those and disrupt the way that our providers practice medicine. But it's really very, very helpful to understand what technologies, modern technologies, could be put in that can absolutely of our physicians, as well as increase the security posture of our organization. And it's not always clear in healthcare exactly who can do that. So I think that's a good one as well. And then also how to better improve resiliency if an attack is successful. So really understanding how to get operations back online quickly without creating further complexity as well. So I really think those are three areas that our partners can definitely help us out.
That's great. That's great. And it does feel like there's an opportunity for our industry to rally, and take what we've learned from certain sectors and cross-pollinate and in and out of healthcare, right? The financial
absolutely.
industry and the Department of Defense and all that. So it's we're in this together, Howard.
Yeah, that's exactly right. We are in this together. And so anything that like one technology could bring to healthcare that you've learned from Department of Defense, I'm telling you that we're all ears when it comes to that type of approach.
Well, perfect. Next question. According to HIPAA Journal, researchers identified 270 healthcare ransomware attacks in the United States between January 2016 and December 2020, which affected about 2,100 hospitals, clinics, and other healthcare facilities. The attacks resulted in the theft or encryption of the records of more than 25 million individuals, with the overall cost to the healthcare industry estimated to be $31 billion. What does a comprehensive ransomware plan look like, including technology, personnel training, and remediation plans?
Well, that is a very big question, Matt. It's also it also just goes to the first question, which that you asked, which shows we're not doing very well, right? I mean, 21 hospitals, clinics, and healthcare facilities being attacked and successful, and affecting 25 million. It was probably higher than that, to be perfectly honest with you.
Yeah.
Paying out 31 billion, that just increases the cost of healthcare to everybody, and so that's all of this is just bad news. So I think when you look at a comprehensive strategy, you really have to understand that plans around ransomware or any other downtime that you might have from an operational standpoint, it's a mix of people, process, and technologies. So having a good response plan is really probably where you should start. Really understanding how you're going to respond to a ransomware event. You need to define the people, technical expertise that's needed, law enforcement contacts. If you have cyber liability insurance, they can be very helpful. Forensics firms, your restore processes, all of these things have to be into your plan. And so I think having a good, strong plan is a good place to really start. And it's going to take bringing all these different areas together and really practicing your plan as well. And you really can't forget marketing and communications in your legal teams. You're going to have to address your customers, in our case, patients and families, the media. You really need to prepare in advance, like holding statements or critical communications for your executives to follow, because you don't want them necessarily out there, winging it. For example, you really want to stay on message as well. So all of those things need to be part of your plan. So I would say definitely a bit, your plan is extremely important. Then you need, you have to practice. That's a big one. Go ahead.
Have you considered asking the state-sponsored ransomware attackers politely to leave you alone?
Yeah, absolutely. You just very politely reach out to them and say,
Yeah.
hey, please don't attack us. And they're very receptive.
They're very receptive. Yeah. That's okay. Good. We'll call that plan A. And if that
It's
doesn't
plan
work,
A.
we'll use yours. Yeah.
And another one is they do say, if you just pay them, they'll sign an affidavit that says that they won't release your information. So I'm sure that'll hold up in a court of law too.
Yes.
Yeah,
Exactly. Whoever they is.
whoever they is.
So that's it.
Yeah,
Oh,
I was
go
just
ahead.
going to say another one. One thing I don't want to forget is really training your associates. You have to train your workflow your workforce. That's a big part of the equation. If you're running simulated phishing attacks with retraining for failures, how to teach them how you want them to act if they receive like a phishing email or a social engineering attempt, those type of things. And you want to reinforce good security practices. That's another one. And then when it comes to technology, you really need to take your defense in depth approach and ensure you're practicing good security hygiene. You want to defend, you really can't defend an insecure network. So you really need to understand, from your risk assessment, where the risks and what you need to do, whether it's a people, process, or technology to close those gaps. And, a couple of things I would point out is, weak remote access into your network is a huge risk, and they're looking for that constantly. So multi-factors are a very big part of your security posture for remote access. What's your patching cadence, because unpatched vulnerabilities is something they definitely look for as well. I think here recently, they've been targeting a lot of the, another one like print spooler, print nightmare, they called it. How you're responding to that. And so, a lot of times now there's critical vulnerabilities coming out and they're attacking them, extremely quickly now. So you have to be rapid in your response to critical vulnerabilities. And then, having good ingress to your network, understanding that, good technologies around protecting against phishing, a good EDR system, endpoint detection response system on your endpoints is very helpful as well. So start with your plan, hit your weakest link on your network, which is your people, then look at defense in depth with your technologies.
You mentioned the affidavit and the ransomware attackers not coming back, jokingly. Even when healthcare organizations do pay the ransom, they only get about 69% of their data back on average, and the rest remains inaccessible. This means that even if you do pay the ransom quickly, the mitigation is still extremely disruptive to the organization. What is the best advice you have for a fellow chief information security officer who finds themselves in a ransomware scenario?
Yeah, man, I tell you, I think probably what I would say is you're not alone. You're not the first. You won't be the last available. So just understand that's definitely a big part of it. So, you plan for this. So work your plan, guide your organization through this crisis, lean on and trust your expert resources, because you're not doing this all by yourself. This is an organizational issue and problem, and you need to guide the organization through it. So, just be prepared, work your plan, and realize you're not alone.
And it's been, ransomware attacks have been disruptive enough to, countrywide, whether it's gas shortages,
Right.
from pipelines to, I feel like the layperson is sympathetic to the disruption of ransomware. I don't think anyone's, the days of the early attacks where, people were blamed. I think that's, all you can do is your best, right? Because there
you
is
really
just,
can.
Yeah.
And I can tell you though, I definitely see more government regulation coming from all these
Yep.
attacks. That there's all in place now from the due to SolarWinds attack, that's probably going to make us in critical infrastructure have to report to the federal government within 24 hours of an attack. So there's other things that are driving too, and so but you're right. I think the velocity of the attacks, the number of the attacks, has made people understand that there it's just epidemic. And so I agree. I think blaming people, blaming the office of the CISO for that type of attack, it's not nearly as prevalent as what it used to be.
Yeah, lacks some nuance
Mm-hmm.
to the real exposure. So, final question, Howard.
Yes.
What is the best professional advice you've received as a CISO? I know you've been in this role for a while,
Mm-hmm.
but early in your career in this position, what was some advice that that got you on the course you're on?
Yeah, well, I think first of all, just getting into the field itself, I had a good friend, Jerome Went was his name, and he was kind of forward thinking in a lot of ways in technology back when things were pretty young in networking and IT, and he encouraged me to get into the field, and he was very instrumental in me wanting to get into IT and build my career there. And one of the things I had learned from him early on is that there's you can't know everything. You really have to hire good people, and you have to lean on and trust those people. And that's one thing I've carried with me is it's really about people and leading people and hiring good people. So I definitely give Jerome a lot of credit for that in my career. The other one I would say is that early on, when I got into security, you really kind of come in with this thought process that it's more technology driven than what it really ends up being for you. It's a lot of people and process. And one of the things that I was told very early in my security career is that security should complement the business. It should allow it to flourish in a secure environment. It should not be a barrier to the business. And I've always hung on to that. So whenever we go into any type of, technical rollout or any type of, technology improvement, you really want to look at this from the eyes of the business and understand how are you improving the business by putting, some security control in place. And so those are probably the two things I lean on still to this day.
And Jerome sold you on the position when he told you that you'd be able to have constant anxiety and get up to 90 minutes of sleep a night.
Yeah, he really left that part out. He didn't tell me about the high blood pressure and
yes,
and the strain and stress on on daily life. You know what? It's been a lot of fun. I've seen a lot of change in this industry since I've got into it, as you have, Matt. And I'm excited about the future. I think it's going to be a lot of fun.
Absolutely, and there will always be the next phase of threats, and as a community we'll work through them, and continue to move the enterprise technology ball down the field.
Absolutely. Well,
So,
One Technology is doing a great job in that space, and I know as we go down this path that you're just going to continue to do great things on your side as well.
yep, and we're very much trying not to be shy about helping folks, and your willingness to jump on here and talk to security professionals, healthcare security professionals, and even lay people that are curious or nervous about ransomware in general is much appreciated.
Well, thank you. Appreciate the invite, Matt. And as always, thanks for being my friend, and best luck to One Technology, and thanks for having me on the show.
Thanks for quoting Golden Girls. Thanks for joining us, and thank you, Howard.
Take care. Appreciate it.
All right.